Hi, I'm going to show you the adductor squeeze exercise. This is basically just a pelvic bridge with a small modification. So what I'm going to have you do, I'm going to have you take this ball right here, put it between your legs and squeeze right at your knees. What this does is it turns off the external rotators and the abductors of the hip, making a more pure glute firing exercise is what we're really looking for. So from this position, I just want you to bridge your pelvis up and continue to squeeze on the ball. And ideally you want to get to about horizontal right here. She's not quite making it there. Good. And hold for 5 seconds and you come back down. Go ahead and come down. Okay, and up again. Common mistakes with this exercise is you're going to feel it in your low back. The way that I correct this generally is I have the patient take your fingers and stab right inside your glutes right here. By doing this, you make a visual picture of the glute contraction. This is what you really want. This whole motion should be performed with hip extension. The fault when you feel it in your low back is that when you have too much lumbar spine extension, and commonly they're put together. But what we really want is a hip extension. So this can be substituted with any firm pillow, a can even. So go ahead and keep doing that. Where you should feel it. You should feel it in the glutes right here, as well as the hamstrings. Ideally, you want it mostly in the glutes. The hamstrings is a secondary thing. So the hip extension movement pattern is the way it's supposed to go is you're supposed to get glutes, hamstrings, and then low back. So you're going to get part of the hamstrings anyways. If the hamstrings cramp in this exercise, go ahead and move the feet out a little further this way. Okay, squeeze the ball and just continue. So this is helping to restore the hip extension movement pattern by re-educating the glutes. Using this exercise in conjunction with active release techniques generally provides pretty good results for sciatica, low back pain, buttocks pain, or hip pain. But this should be performed 1 time a day, 10 to 12 times. If you can make it to 1 or 2 sets, or 2 sets a day, that's ideal. But 1 set should be sufficient.